Hey, it's Steve Marshall in for Jenny, and I get to spend some time with Dr. Kohli. She is the 9 News medical expert. She's also accepting new patients at her Cherry Creek Heart in Aurora location. And let's talk about some caffeine. Dr. Kohli, I'm a huge coffee fan.
Same here, Steve.
Okay, good. A new study I know just came out from the American Heart Association conference, and they're talking about how coffee is pretty good with AFib. What exactly is AFib first?
Yeah, the whole cardiology community is buzzing about this study. So let's talk about AFib first. Atrial fibrillation, or AFib, is an electrical disturbance of the heart. It's very common. 10 million Americans live with it. It's a chronic disease. And the most common risk factor is aging, but certainly extra weight, high blood pressure, sleep apnea, too much alcohol, living at altitude, like we do here in Colorado. All of these can be risk factors for developing AFib. And once you develop it, it doesn't really go away, and essentially means that the top chamber of the heart, the atria, fibrillates, meaning instead of squeezing in a nice kind of coordinated fashion, it sort of jiggles. And so there's two consequences of that. One is that the bottom chamber gets confused with the jiggling and starts racing. So you can feel palpitations, shortness of breath, irregular heartbeat. You can get your heart rate up to 130s, 140s, 150s just sitting there. And it starts giving you symptoms. And the second is because it's not squeezing hard, it's just sort of jiggling, you can get blood pooling inside and get blood clots that can go to your brain and cause stroke. So AFib is a significant problem, and certainly we manage it with medications and sometimes with electrical shocks to the heart. But really the question of nutrition, what we eat, and how it affects our AFib has been something we've been questioning for a while.
So, I mean, we've heard various things ever since I've been around on the earth. Caffeine's good, bad, coffee's good, bad. So what did they come up with this?
Yeah, so as my patients ask me all the time, if I have a cardiac arrhythmia, can I take caffeine in coffee? Which we've worried has been stimulating. And the studies in the past have been sort of mixed, so we weren't sure. So what this study did, which was brilliant, was that, okay, let's take patients who have AFib, who are people who have drunk coffee before. So they're sort of used to drinking coffee. They like to drink coffee. And they're back in sinus rhythm, which is a normal rhythm. And we randomize them. So we say, you drink a cup of coffee a day and you don't. And so that's the best type of science we have, because it controls for all the other factors. If we just watched what they did, then it could be basically confused by the fact that the people that drink coffee maybe are healthier people, or people that don't drink coffee, or you know what I mean? So this way we say, okay, the computer decides whether you drink coffee or not, and then we control for all the background factors. And they found out that the people who drank coffee had a 39% lower risk of going into AFib. So the idea here is that caffeinated coffee is actually protective against recurrence of AFib. Now, this blows our minds because we've sort of always thought of caffeine as a stimulant. And I want to be clear here that it's not necessarily the caffeine. It could be the coffee that's doing it. So this doesn't necessarily apply to energy drinks or other caffeinated beverages.
Energy drinks are not a good thing anyway, for the most part.
So for my AFib patients, or in fact, any of my cardiac patients, no, hard no on energy drinks. But if somebody asks me today, after this science, Dr. Kohli, I have AFib, can I have a cup of coffee a day with caffeine in it? I'm going to give it 2 thumbs up on that.
And is it just 1 cup, 2 cups? Is there a limit?
So they studied only 1 cup. And that's a great question. Is there a limit? Is there a possibility that there's a threshold effect, that if you increase the dose of caffeine, in general, we say 1 cup of caffeine, 1 cup of coffee with caffeine is about 100 milligrams of caffeine. And you want to stay below 200 a day. So I say usually you can drink maybe 1.5 cups or 2 cups at the most if they're smaller cups. But really try to track your caffeine intake, especially because, again, we live at high altitude where the caffeine can be a little bit more stimulating. We don't know whether 2 cups is more likely to cause arrhythmias or anything like that. We also don't know if this applies to other electrical problems, other arrhythmias. We know that too much caffeine can raise your blood pressure. But I feel very positive about this, that caffeine in coffee in moderation can potentially be protective. And we know that coffee has a lot of beneficial effects. And studies have shown that for a while. They've got antioxidant effects. It affects our blood vessel function. It, affects our metabolic health. More importantly, I love the taste.
That's me. So I'm glad you're telling me this, because now I can be armed with facts when Jenny comes at me about, because I get on her about her Diet Coke. And
so how much coffee are you drinking,
I'm
Steve?
usually about a 2-cupper a day.
And we're talking normal sized cups.
Normal, I get up in about 9 ounces, and then I get up so early that I spread them out over about 5 hours. So
I love that, because the dose of caffeine is dependent not just on how much you drink, but how quickly you drink it as well. Just like with alcohol. And so I would prefer that you drink it over 9 hours, if you drink 2 cups rather than drinking 2 cups over 1 hour.
Right.
Because then all of a sudden you've been exposed to more caffeine as well.
That makes sense.
Yeah.
Glad to hear all this. So see, coffee lovers, it's not so bad to have a cup and a half when you're doing, even if you've got some heart things, but check with your doctor.
Talk to your
of course.
cardiologist
I was
or
gonna say,
come see
check
me.
with your doctor, of course. So Dr. Kohli, thank you for coming by.
Thank you,
Appreciate
Steve.
it.